Today's surgery is a 40-year-old patient with squamous cell carcinoma of the tongue. He is from North Kordofan, by maybe 500 miles away. He presented to the oncology team with a tip of the tongue cancer. He underwent excision of the cancer with lymph node dissection of the neck, simultaneous reconstruction of the tongue using a forearm flap. This is the first surgery of its kind done at this hospital. We used a flap from his forearm to reconstruct his tongue using the recently donated surgical microscope. This is a very delicate procedure. It's long, it takes a lot of expertise. We did a lot of training and rehearsal for this procedure. We did workshops in the lab and cadaver dissections and live rehearsals. We trained local junior surgeons to perform this procedure, and the plan is to keep doing these procedures, which are severely lacking in Sudan. Most patients with cancer, they get resected, but no reconstruction. Hopefully this would be a breakthrough for surgical practice in Sudan.
This operation is the first of its kind to be done here in Sudan, and I had the pleasure of witnessing it here at Khartoum Dental Teaching Hospital. Being a resident at the Oral Maxillofacial Surgery Department, this is a great operation to be witnessed, especially that I'm at the beginning of my program. A lot of my colleagues did not have the chance to see it before, and being able to see how it's done, the procedure, being taught by Dr. Haitham, it's been an amazing experience. We really appreciate the donations that have been made for this operation to be done as smooth and efficient as could be. I'd like to thank the Sudanese American Medical Association for this invaluable donation, and hopefully this will improve the quality of service and the quality of life for the patients to come.
Day 2 of our big surgery. The patient is doing well. We just saw him. I saw him yesterday. I saw him today. The flap is alive. He's doing really well, recovering well. He's in good spirits. I spoke to his family. They're from North Kordofan. It was a sad story because he had to delay his treatment with his cancer because he didn't have the money to come all the way to Khartoum to get his surgery done. Behind me is the ICU, which was built about a couple of years ago with donated money. This was a first big transformation. The second one was obtaining the surgical microscope, and I'd like to thank the Sudanese American Medical Association. A lot of efforts in bringing the surgical microscope. It took over a year, and I would like to thank the Shriners Hospital for donating Cincinnati for donating the microscope. It took us a lot of effort, a lot of money to bring it, but we're finally we're able to do it, and the training hopefully will commence and will continue.